no, I'm sorry. Right over here. Right over here. Okay. All right. And then what's the last thing I'm going to need? My sectioning setup, okay? Because how am I going to section? All right. Before you do anything, and if you know you're going to be sectioning, make sure this works, okay? So what's the setting for adults when I do sectioning?
Oh, it's like 100 to 125 millimeters mercury?
Yeah, 100 to 150 or 125, okay? So you just want to test it. So how do I test this?
Turn it on.
Turn it on.
Okay, turn it on, but what do I do?
And
Okay.
Yeah, put it on here.
And then what? I kick it, right? And I turn it on, continuous, okay? And then I just want to hear if it's sectioning, okay? And it should work, okay? So let's just pretend it's working, but it's not working, okay? So I turn it off, and then look over here. You've got different spats for different things, okay? Over here it says vacuum, okay? So I'm going to attach it to here. And then for my sectioning right over here, I'm going to attach it to the patient, okay? We don't have a patient right over here. Okay. Keep this covered. Okay. Okay. So vacuum and patient. All right. Okay. So, all right, I got my stethoscope, this and that. All right. So, and then obviously I would have this to my height, body mechanics, and show this bed doesn't work, I know. But what is the position that my patient should be in when I do this?
semi-Fowler.
Semi-Fowler. If they're unconscious, how should I face the patient?
Sideline.
Facing me. Okay, so you always have the patient face you. Okay. Also, it's a good idea if you can, aside from wearing a face shield, it's a good idea to wear a gown just in case, because this can be messy. Okay, and sometimes it'll hit you. Okay, so you want it to hit the gown or the protective gear instead of you. Okay, all right. So what's the first thing I do? Did you guys bring your checklist? Bring your checklist because we're testing you off of this. Okay. Okay. So, anyways, verify the order for sputum. We'll talk about that in a bit. I'm going to perform my hand hygiene. Okay, I brought my little hand gel here. All right. I'm using the hospital, so pretend this is the hospital's. Okay. All right. If the patient was alert and oriented ×3, I would explain the situation. Hi, Mrs. Jones. My name is Alana. I'm going to be your nurse for today. I just want to let you know I hear a lot of crackles in your lungs. I'm going to auscultate your lungs, and if need be, I'll probably section you. Okay? All right, so I explain the situation, ensure privacy. I check my doctor's orders to see how often I section. Sometimes you may have orders to section Q4 hours or PRN. Okay? But before I do that, I want to check my vitals. I want to see their heart rate and their respiration and their oxygen saturation. So heart rate's at 80, respiration right now it's at 25. Is that normal?
No.
Right, so they're breathing hard, okay? And I hear, even without a stethoscope, I can kind of hear them gurgling, okay? But I'm going to listen anyways. Okay, so how do I listen for lung sounds?
The chest.
Yeah, where do I go? All the way down to the left, and then that's it?
No, both sides.
Both sides, exactly.
To
All
the
right.
6 side.
That was a trick question.
Yeah.
Okay, over here. All right. They sound kind of wheezy over here. Okay. Diminished. And I hear a little bit of crackles. Okay, and it's very diminished here. And very diminished at the bases. Okay. Oxygen saturation's at what, around 91%. Okay, and they're at what? They're on a vent, and so they have their own special settings. So this patient needs to be suctioned. Okay. All right. So I have this ready. I have my ambu bag ready. Okay. So make sure that all this stuff is ready before you start opening things. Okay. And then when you do this, pardon me, it's a good idea to have this table actually by you, okay? Because you don't want to reach over and grab all your stuff. And then once I start opening things, this now becomes a sterile field, okay? When you get into your practice, different nurses do things differently. So just take the good from it, okay? All right, so I'm gonna put my face mask on. I'm just gonna put on clean gloves for now. I've attached my sectioning tubing to the section. I've tested it, it works, okay? All right. Okay, so now I brought an extra gloves because you never know, because sometimes accidents happen, okay? So I'm gonna open up my tracheostomy care set kit, okay? All right, so in here, it automatically comes with the sterile gloves, all right, the saline, okay, and there's a drape there, okay, all right. It's still sterile inside, okay, so I want to maintain sterility, so I'm going to remove my gloves, my clean gloves, throw it in the trash, okay. Now I'm going to don my sterile gloves. Right. Okay, so remember I have that 1 inch perimeter around, so that's considered dirty. But inside here, that's sterile, right? Mm-hmm. So if I need another sterile field, I can use this just in case, okay? So, and again, when you do this, remember I said earlier, get used to working in a confined space. But when you do this, don't use the bed as your desk. Use this as your tabletop, okay? Okay, my right hand's going to be my dominant hand, so I put that on first. Okay, my hitchhiker. Okay, so this is sterile, right?
Yes.
Okay, so I'm going to get my sterile saline or water. Have this ready. I'm going to open it up. Okay, how should this thing be facing, up or down?
Up.
Right, okay. And I'm going to get this ready. Oh goodness, it's like tight in there. Okay, there we go. Okay. Oh, there should be a cup here. Okay, there's no cup here, but you know what, that's okay, because I can use this as my reservoir. Yeah. So then I will improvise. Okay, so I'm going to use this as my reservoir, because normally there would be a cup here where I would pour saline in there, so I can rinse out the sectioning in between, but there's no cup here. Okay. Okay, right over there. So everything's still sterile. Eileen, yes. I think I brought the wrong kit. Can you get me the sectioning thing? Because I need that suction tube.
Do you need what, a suction catheter?
Yeah.
Okay.